and welcome to Chapter 19, Gastrointestinal System Medications from your Pharmacology Clear and Simple. The objectives for this lecture are to define all key terms, detail how the gastrointestinal or GI system functions, identify medications used to treat constipation, identify medications used to treat diarrhea and explain how the underlying cause should be treated, identify medications used to treat nausea and vomiting, compare the different types of medication used to treat gastroesophageal reflux disease or GERD, G-E-R-D, and gastric ulcers. Discuss medications used for gallstones, obesity, hemorrhoids, flatulence, stomitis, and fungal and parasitic infections of the GI tract. Discuss how poisoning and overdoses are treated, and identify populations of patients needing nutritional supplements or those needing assistance digesting their food, and how each one of these are treated. Let's look at the digestive system. The digestive system is responsible for ingestion, digestion, absorption, and excretion. The goal of each function is to allow nutrients from food to be used as cellular energy. The stomach has a high level of hydrochloric acid, HCl, to help break down food for absorption. If this acid refluxes into the esophagus, it can cause ulcerations, and mucosal breakdown basically is what the ulcerations are, which then become a prime environment for the spread of infection. Digestion is the process of converting food into chemical substances used by the body. Bad food choices can overwork the pancreas, liver, and gallbladder, and extreme undereating can lead to anorexia nervosa, and extreme overeating can cause obesity. Medications and microbes can also damage the GI system, so it's important that we are educated on that as well for our patients. Medications for the GI system either treat specific disorders or control certain symptoms. So medications work to increase or decrease function by changing the muscle tone or replacing deficient enzymes or increasing or decreasing the emptying time. Also, rate of passage through the GI system, a medication can regulate that. Timing of GI medication administration is very important. Some need to coat the stomach lining or to reduce acidity, and they need to be taken on an empty stomach. Some foods affect absorption of medication if eaten at the same time. An example of this would be a grapefruit affects absorption of medications if it's eaten at the same time of the GI medication. So it's important to educate the patient and let them know that they should not be not only eating grapefruit, but anything with grapefruit juice at the time of taking their GI medications. Looking at laxatives, laxatives help to promote bowel movements. Constipation occurs when peristalsis slows, and this is leading up to infrequent and hard stools. Therefore, like we said, laxatives promote bowel movements and are classified as bulk-forming agents or osmotics, stimulants, or stool softeners. A cathartic, or also known as bowel evacuators, is a strong medication that facilitates fast emptying of the colon prior to surgery or diagnostic testing. So the bulk-forming laxatives increase bulk and water. They come as a powder to be added to liquid capsules, or they come in a wafer to be eaten. Bulk-forming laxatives are the laxatives of choice for routine use with a patient that is pregnant. And it takes 12 hours to 3 days for this to work. An example of this would be Metamucil. Lubricant laxatives increase the water to fecal mass to ease passage of stool, and these are suppositories. Takes about 6 to 8 hours to work, but sometimes they can work immediately. So it's important that when we're doing patient education on laxatives that we explain that they need to be taken where they're somewhere comfortable, like home, and that they can take 6 to 8 hours to work, but sometimes they can work up to even 5 minutes. So important to tell our patients that. Osmotic laxatives draw water into the stool and irritate the bowel to increase peristalsis. And we know this is the wave-like movement of the small and large intestines. And these are definitely, they take 15 to 60 minutes, but these could be immediately. So again, just really talking to our patients about the time frame it can take and have them being prepared to be able to be in a place of comfort when they're utilizing these types of medications. Also, it's important to note that glycerin or sorbitol are contraindicated due to the stress on the cardiovascular system. So if a patient has hypertension or edema or congestive heart failure, it contraindicates. Milk of magnesia is a mild osmotic laxative and it works in 2 to 12 hours. It is safe for hypertension, edema, and for congestive heart failure. So instead of looking at the glycerin or sorbitol, milk of magnesia might be an option that the doctor might look at. Stimulant laxatives stimulate the peristalsis by irritating the bowel. They're effective within 6 to 8 hours. An example would be biscotal and castor oil. And this is not to be used in pregnant or lactating women, although you hear that all the time. People say, oh, if you're overdue, go for a walk, drink castor oil. So again, they should be consulting with a physician prior to doing that. And it can cause premature labor, and also it can cause diarrhea in a breastfed infant. So that's why they're not to be used in pregnancy or lactation. Side effects of the stimulant laxatives can be cramping, diarrhea, flatulence, and nausea. Looking at stool softeners, these decrease the consistency of stool and attract water and fat to the stool to soften. Used in bedridden patients or those with limited mobility. And Colaze is an example of this. They also give Colaze often when you're going into surgery because the surgery itself and the medications slow down the GI tract. And so when they're being proactive, a lot of times they will start Colaze in the hospital and then have you continue taking also when you're taking your pain medication because that can cause constipation. So just a little side note there. Bowel evacuators, these are cleansing solutions. Typically before diagnostics tests, it's to remove the stool. Patients drink 1 gallon of fluid mixed with medication within 2 to 3 hours. Side effects are bloating, nausea, and fullness. And an example of this would be the Go Lightly or the Glycolax or Miralax. That brings us to comprehension check number 1. This type of laxative is for routine use and safe in pregnancy. If you selected A, bulk forming laxative, you are correct. It's important to note here, talking about diarrhea and treatment of diarrhea, that diarrhea is a symptom, not a disease, and may be a result of exposure to chemicals, anti-infectives, or other medications. Can be inflammation, infections, anxiety, and circulatory disorders can also be what causes diarrhea. There is a risk of fluid loss and electrolyte imbalances occurring as a result of unrelieved diarrhea. And the goal of therapy is to treat the cause of diarrhea and to prevent dehydration and electrolyte imbalances. Antidiarrheals are administered to inhibit the GI motility. They decrease peristalsis and slow the function of the GI system. The 2 main types of medications used for this are opioid-related and absorbent antidiarrheal medications. So opioid-related antidiarrheals are used in the most serious of cases. They inhibit GI motility, they decrease peristalsis, they slow function of GI system. Examples of this, Imodium is one of them that you've probably heard of. Lomotil is another one. Absorbents, diarrheal medication. These are taken after every bowel movement to absorb toxins or bacteria and to coat the walls of the GI tract. Examples, Pepto-Bismol, the pink stuff. And just a little side note that's normal in the use of Pepto-Bismol, stools and tongue may turn black, and this is because of the bismuth in there. So when we're doing patient education or you speak with a patient that's concerned about that, it is something that is seen. It is a normal interaction. And again, it's the interaction of the bismuth and the sulfide in the GI tract, and this causes that black color of the stool and tongue. Let's see, kaopectate is another example. Medications to treat the cause of diarrhea can be antibiotics. The main ones, some examples, Cipro, Floxin, Zithromax, the Z-Pak. Anti-inflammatory drugs, these are used to treat inflammation causing diarrhea in patients with ulcerative colitis. So this is specific to that. And some examples would be sulfasalazine, valsalazine, and osalazine. This brings us to comprehension checkpoint 2. The focus of diarrhea treatment is stopping the diarrhea. Is this true or false? This is false. The focus of diarrhea treatment is treating the cause of the diarrhea. Now we're looking at the antiemetics. So emesis is vomiting, so decrease of nausea and vomiting and to treat motion sickness. And antiemetics decrease nausea and vomiting by blocking receptors in the area of the brain that stimulate vomiting or blocking the chemical serotonin in the brain and in the stomach. Other antiemetics are believed to block signals to the brain movement center to prevent and treat motion sickness or act on the chemoreceptor trigger zone, which allows medications or hormones to initiate vomiting. One other way that antiemetics may work is to decrease the hyperactivity of the smooth muscle of the gastric mucosa. These classifications of antiemetics include, and we're going to go through these one by one, phenothiazines. These block dopamine receptors that stimulate vomiting. And for chemotherapy-associated nausea and vomiting, this is what's used. Also, we're going to look at how they're administered. So I just want to remind you, PO is by mouth, IV is intravenously, IM is intramuscular, and PR is per rectum. So looking here, examples or thorazine, they are given PO, IV, and IM. So that means by mouth, by IV, or intramuscular. Good. And Compro, also given PO, IV, IM, and PR. So it added the per rectum. And these are given by prescription only, and they cause sedation as well. Oops, I went the wrong way. I apologize. So the next one is the 5-hydroxytryptamine 3-receptor antagonists. These are used to prevent and treat nausea and vomiting associated with chemotherapy. They block chemical serotonin produced in the brain and in the stomach. And examples might be the Zofran taken by mouth intravenously, intramuscularly, or the Aloxi by mouth or intravenously. These are also prescription only. Antihistamines block signals to the